we've been talking all things private care, both in response to COVID and outside of COVID. But I think one of the looming questions is, do Canadians want this? When polled, do Canadians or are Canadians open to the idea of private care? And so I put this to either of you. Do we have any evidence that this is something that Canadians want?
So we actually did some public opinion research at the end of 2021. We hired Leger, a national respected pollster, to look at this issue. And what we found was that there's been an increase in the number of Canadians who are open to the idea of allowing patients to pay out of pocket at private facilities if they don't want to use the government system. 62% support that option. And that's up from 51% just before the pandemic began. So there's been a significant increase there. I think it's good news for patients, because if governments, as Ash and I have been talking about, if we have these two options and more choice available for patients, ultimately that's a good thing.
And so, Ash, do you think that some of that uptick is a result of the pandemic highlighting these problems?
So with or without a pandemic, we've had increasing wait lines and worsening results in our healthcare system. And that's just because of the nature of the fact that this is a government monopoly, and decisions are not made on a profit and loss basis, but on a bureaucratic basis. And when you make decisions on a bureaucratic basis, you have to choose some arbitrary measure, some arbitrary outcomes to pursue and forego others without any concern about costs. And this is what happens. And what we ended up with is the choice to have long wait times, but allegedly universal access. But I say allegedly universal because it's not universal for those stuck on the wait time.
Mm-hmm. Yeah, of course. So if we were to frame this to Canadians, or I were to give you the opportunity to say, Canada's healthcare system should look more like which country? Which country do you think that what country do you think we should emulate?
So I would say that Australia is a good one to look at. They outperform Canada when it comes to results. They don't spend as much, so they're getting better bang for their buck. They have more choices as patients. Like I said, you can use the public system in Australia. You can use the private system. You have that choice. So I think they'd be a good one to look at. A lot of European countries are worth taking a look at as well.
Ash, do you have any suggestions on who Canada could emulate?
Well, emulation is difficult because every country has unique political and constitutional restrictions.
Sure.
But I think it's definitely worthwhile looking at what's happened in Sweden over the last 2 years, a country which has never implemented the sort of lockdowns that we had here. And even though they were alleged to be invoking an experiment of mass suffering and death, their hospital system handled just fine and continues to handle just fine. Even though most citizens went out and lived their lives pretty much normally as before the pandemic. So it's worth investigating as well.
And so it would be of your opinion that if we had a healthcare model more like Sweden, we would be better prepared to deal with any uptick in hospitalizations, therefore decreasing the need for some of these lockdowns, which of course have pretty devastating impact on mental health and the economy?
So again, the point was, at the beginning of the pandemic, the warnings were that if we do not lock down, our hospitals will be overcrowded. Mm-hmm. People would be dying in the streets. Those were the actual warnings of the press and others. But Sweden did not lock down, and they did not have a hospital crisis. So the fact that they didn't lock down and their healthcare system survived is worthy of study just for that reason.